Bismillahirrahmanirrahim. We begin in the name of Allah, whose grace, guidance and mercy we seek in this and in all matters. Blessings and salutations to our beloved Nabi Sallallahu Alaihi Wasallam, his descendants and his companions. Assalamu alaikum rahmatullahi wa barakatuh. My name is Anisa and I'm with you on Get Real with Islamic Care Line. Today we have a special guest with us today, Hanifa Ibrahim, psychologist by profession, here to chat to us about anxiety and depression in the community. Welcome, Hanifa, and Jazakallah for joining us today.
Thank you for the opportunity, Anisa.
Okay, we're going to quickly go into our discussion, right? Firstly, when should a person be concerned about just feeling down or sad? At which point?
I think we all need to remember that feeling down or sad from time to time is a normal emotion, but when it starts to become a case of concern is when it persists over long periods of time, where we start to feel sad and down most of the time, and we're not feeling as happy as we used to before, or we lose interest in pleasurable things that we perhaps enjoyed before. And it starts to affect our functioning, and that's when it becomes really of concern. So if we're not going out and exercising, if we used to exercise, or we're not going out and playing golf, if we love to play golf, that's when we should start becoming concerned, when our lifestyle starts to change because we're feeling so down that we can't do the things that we used to do.
Okay, and would you say that, and I know there's lots of other symptoms that we can go into,
Absolutely.
And unfortunately we are so time constrained, but I think the focus of this program is a little bit more on, or more proactive than looking at signs and symptoms. But you know, we've included anxiety as well. What is there a relationship, and what is the relationship between anxiety and depression?
Remember that anxiety is a normal emotion. It's normal to feel anxious from time to time. You might have a big exam coming up and we feel a bit anxious, and it steers us into doing what we need to do. And that's healthy anxiety. But there is anxiety that becomes debilitating in the sense that it persists for long periods of time, and we start to feel that we can't do anything because of this anxiety. Anxiety and depression can occur on their own. So you could have depression without anxiety, you can have anxiety without depression, but you can also have them together, but it's a little bit more complicated to treat when they are together. So depression and anxiety can occur together, or they can occur individually. Yes, and they're both quite difficult to deal with when you are
That sounds quite overwhelming as well, and it must be
extremely.
more so, I think, for someone who's experiencing it.
Yeah.
Okay,
Yeah.
and like you say, you know, a lot of stuff, normal people who don't struggle with anxiety and depression struggle on a bad day, and it must be more so for someone who's possibly diagnosed.
Yeah.
Okay, so speaking then of diagnosis, right? What does someone do to get help? How do you get treated? How do you get diagnosed and then treated?
You need to go to a professional who deals with anxiety and depression. So your psychologist will assist you in understanding if you have the symptoms and signs of anxiety or depression. You can go to a medical doctor who has an understanding of depression and anxiety, so a GP. But then the specialists in these fields are psychiatrists, so they're medical doctors who specialize in mental health issues. So we would go to a psychiatrist in order for them to diagnose us and then to help us with treatment as well. So everybody who feels depressed or has depression doesn't need to go to a psychiatrist necessarily, but those who have moderate to severe depression might need a psychiatric diagnosis. But starting off with a psychologist or even a clinical social worker who has some understanding of depression and anxiety can assist us in helping us to move forward and deciding what to do next.
Okay, so you've mentioned psychologists and social workers. So I think the message that you're giving is therapy is an important part of treatment or healing and getting help. And it's not just about medication.
Absolutely.
And that's why I want to take us to our next point is what are some of the effects of medication, especially antidepressants. And I know that people sometimes get addicted to it, and that is that a real concern?
I need to dispel the myth that antidepressants are addictive. They are not addictive by nature. Psychologically, someone might think, I can't do without this.
Okay.
But they're not addictive in the sense that, you can't detox from it or you can't stop it. You can with a certain process that we follow. So antidepressants have their role in the treatment of depression. We must realize that depression is also a chemical imbalance in the brain. And when there are when this imbalance is there and it persists for long periods of time, we need to restore that with medication. So that helps to normalize the chemistry in the brain. So yes, and when people take medication, initially you do see some side effects. So dry mouth, maybe the stomach gets a bit irritable, you might people feel a bit fatigued or tired, and antidepressants take up to 6 weeks to start showing some effect. So it's not this magic pill we take and suddenly we're bouncing off the walls. It's actually something that you take and your body needs to ease into it, and it starts to slowly work. So from anything from 2 to 6 weeks, you're going to see a difference. So initially you actually feel pretty horrible because of the side effects. And not everybody has the side effects, and not everyone has side effects as such. And when it's time to wean off the medication, we need to follow a process with our medical practitioner. So you don't just decide today, oh, I'm not going to take it, and you start to feel sick because your body got used to having the medication in the system. So we must be very careful, and we also have to persevere. So we can't take it for 2 days and then say, oh, this doesn't work for me, so I'm not taking it anymore. You've got to persevere with the medication. But remember, psychotherapy together with medication seems to be a good combination. Even from research, we're seeing that we need the psychology aspect so that we develop some coping skills when we stop the medication, because ideally nobody wants to be on medication forever. Under severe conditions, some people do need to take it forever, but not everybody needs that.
Would you say that it would take a life event or a stressor to trigger depression, or can it just be? So why I'm asking this question is because you mentioned coping in therapy and coping skills and developing those, right? So if, let's say, for example, somebody is struggling with depression and you say, but there's nothing going on in my life that I need coping skills for.
Yeah.
Would that be something that's heard of, or in most instances, are they triggered by something that's going on?
There are two aspects to depression. The one is that some people do have a genetic predisposition to something, so anxiety or depression. Okay? Doesn't mean, when we say a genetic predisposition, we mean someone in our family, somewhere along our line, our ancestors has had depression or has been through a depressive episode, and therefore predisposes us to becoming depressed or anxious. So there is that genetic component, but we do know that there are external factors that do impact on how we're going to manage that, or if we are going to fall into a depressive episode. So it's not necessarily that you will fall into a depressive episode even though you have a genetic predisposition for it. It might be that you lack a support structures. Your personality might be something that, for example, you might be a perfectionist, and when things fall apart, you fall completely apart, and you can't, you don't have control, and you can't allow yourself to just make mistakes. So your personality will play a role, your support structures will play a role, also how resilient you are. So resilient is your ability to bounce back after a life event. And it doesn't necessarily even have to be traumatic. Now remember that life is not meant to be, naturally smooth sailing. It's meant to have challenges. And so certain things will impact on how we perceive a life event. So we can either go in there seeing it completely negative, or we have some ability to see the positive in negative situations. So for example, if someone falls ill, you feel overwhelmed by it because you've got to take care of that person, but perhaps you find an inner strength and you can say, well, if he never fell ill, or if I didn't go through this, I would never have learned that about myself. So that ability to find something positive in a negative situation. So there are those factors. Also, generally, I think the problem is that we often wait until we become depressed and then we say, okay, now I need to develop coping mechanisms, now I need to do things. We don't have a proactive approach to life where we say, actually, I need to build this store of resilience so that when the time comes and I'm stretched, I have some things in store so that I don't become overwhelmed. So, for example, don't wait until you're sick to actually exercise. Don't wait until you're really overweight to start losing weight. Generally, all aspects of our life to start developing some sort of coping mechanisms, be it around learning to think more positively, learning to eat well, learning to exercise, being spiritual, learning to laugh. I mean, these days you can go for yoga and laughter yoga to actually feel a little bit happier. But do we really need that? I mean, do we have to teach ourselves to laugh? So those little things are like stores that we put in place so that when the storm comes or when things happen, that we have a bit of that already in place. Just simple things like enjoying the fresh air, going outside, seeing sunlight, having good relationships, doing coffee with a friend, those kind of things. You don't have to wait for trauma to have them. You can actually just develop them in your life already so that when time comes, you know where to go to feel a little bit better. Yeah, so I think
my next question was going to be, although when I started out with the medication and I wanted to know how would one manage side effects, but I think we kind of moved away, and it was leading into my next question, which was going to be, well, how can people manage their own depression and anxiety? And you spoke a lot about this. There's something else that you said that made me think about responsible management and taking responsibility for your life, but also you spoke about a lot of preventative measures that people can put into place in setting a healthy foundation in a way for their physical and their mental health, right? But is there anything that you want to add in terms of aside from preventative, once someone is diagnosed, what they can do to manage their depression or their anxiety?
Okay. For me, the most important component would be firstly acceptance. Accepting that I am depressed or I do have anxiety, because often when we play this tug of war and we fight and we kind of say, I'm weak if I say I'm depressed, or I'm not good enough because if I have the illness or this mental health illness, I think the first point is accepting that this is a condition, I have it and I can work with it. Most often anxiety and depression is treatable, and the moment we start saying that, the easier it becomes to start dealing with it. So that's the one thing. Psychotherapy, an important aspect of it. Any form of psychotherapy, it doesn't have to be one-on-one individual therapy with a trained psychologist, but maybe also, support groups. They also offer a space where we can talk and we can express ourselves and meet other people who are suffering from similar illness and understand how they cope. So I think acceptance, looking for that support and asking for the help, that's important. Yes, so those are the most important things I would say.
Okay, I think our discussion so far has been very proactive, and it's been very positive for a topic like depression, where people feel more this down. But we need to take a short break, and we'll continue shortly thereafter. Assalamu alaikum once again, and welcome back to the second segment of our program, Get Real with Islamic Care Line. Okay, so Hanifa, where we left off the last time, we spoke about accepting one's condition, and that being depression or anxiety in this case. But there's something interesting that you mentioned, and you said something about someone feeling like they're weak if they diagnosed with depression. Okay, so how prevalent is that perception? How often do people feel that it's a reflection of their own inability or their own level of resilience or coping? And how does that impact on their coping?
It's very prevalent. I think a lot of and specifically from my own experience in my practice with individuals who are diagnosed with depression, often there are people who feel that they're perfectly fine, they work, they usually people who manage their lives pretty well, and when they're diagnosed with the illness, they become quite hard on themselves, and they feel like they failed in some way, and they feel like there's something wrong with them because they're depressed and others are not. Also, I think a huge influence of culture and upbringing as well plays a huge role around how we perceive mental health illness. It's not like having the flu symptoms where you're coughing and sneezing all over the place. Remember, it's something that's very internal, and you can't go to someone and say, well, I know this one's suffering from depression because they look in a certain way or so forth. It's something that happens very internally, and you don't see it. It's not like a bleeding wound. And therefore, often it's hard for individuals who are diagnosed with it to accept and grapple with the diagnosis, and they grapple with the diagnosis. So you see that quite often. And also to share that with family and friends, especially growing up in an environment where, you know what, if you read your 5 times namaz and you read your Quran, you should be okay with life. How can you be depressed? There's that assumption that if I am spiritual, then how can I be depressed? And so then having to share that with other people makes it even more difficult, and therefore often these individuals suppress those emotions, and it makes it twice as hard because you have to mask every time you're with other people to say, you know what, I'm actually okay and my life's fine, but I'm actually struggling inside. So I think this is a huge influence. The culture, the sense of I'm okay, and my life's been okay up until now. So how can I have depression? So yes, I think these factors do influence.
What I'm also thinking is with it is going a lot of pressure to keep it together kind of thing, feeling embarrassed to say I struggle with depression, and so it's a bit unacceptable. And would you say then to a large extent it's still considered to be somewhat of a taboo? Or are we shifting away from that? Is it?
I think in my experience there's now a lot more exposure to mental health illnesses in terms of education. Yes, there is. But there still is that stigma. There's still individuals who don't want to share it, who don't want to tell their partners, who don't want to speak openly about it. And also a lot of internal pressure around being perfect that I see coming up, especially with women, females who feel like they need to keep their homes together and their houses together, and just can't show any sign of weakness. Yeah.
And I think that's sad because we put so much pressure on ourselves. Expectations are great, and yet Allah didn't even create us perfect. Absolutely. And perfection is hard work. Absolutely. And it also has, we can't accept ourselves for who we are. And that's really, really, even for a normal person, not even, okay, I use the wrong word when I say normal, but someone who's not diagnosed with depression or any kind of psychological disorder or challenge. But the pressure to just meet a certain standard, more often than not, it's the standards that we put on ourselves. But, as you were talking then, in something that you said earlier as well, when we spoke about psychotherapy, and speaking about how people perceive a deviation from the norm as such, would you say then also that people's perception of psychotherapy or counseling or any kind of therapeutic intervention has progressed, or is it still something that people look at as associating a problem or you having something wrong with you?
Yeah. I think it's not seen as a tool. It's not seen as a bit of a crutch when I'm going through a difficult time. It's seen as a last resort. I only go to a therapist when I'm really now at the end, when I'm thinking of ending my life, or when I feel so hopeless I can't do anything. So I think it's, there's still that perception that if I'm going to a therapist, I have to be crazy, or I have to be mad, or I have to be at my wit's end to be seeing a therapist. So I think there is that stigma still. And seeing a psychiatrist, even worse, because only mad people go to psychiatrists. Why would you want to see a psychiatrist? And often in my practice, I would say to someone, if you can afford a Rolls Royce, which is your psychiatrist, rather than just going to anyone, someone who has the ability to understand all the medication, all the side effects, has all the knowledge, go to a psychiatrist and go and see them if we're going to go the medication route. And there's that, how can you tell me to go to a psychiatrist? Am I crazy?
There's nothing wrong with me.
There's nothing wrong with me. But if you have a skin disorder, you'd go to a dermatologist. Because I've got a skin disorder, I've got severe acne, my GP is not necessarily a specialist in that field, I'll go to a dermatologist. So if you have a mental health illness, yes, your GP might have some knowledge, but he doesn't have all the knowledge. So I'll say go to a psychiatrist, and already there's that, no, she's taking it too far. Why would she do that? Why would she say that? And there is definitely that stigma around.
I think also, in our context, when parents bring their children in for counseling,
yes,
they don't tell their child why they're there. And I often get the play therapist to say, get the parents, because if you're going to take the child to the dentist, you're going to tell the child why. If you're going to take the child to the doctor, you're going to say why. And again, from there, you still get that same undertone that, there's something not right.
Absolutely.
Kind of thing.
Absolutely.
Okay. But, just on that note, and people, I think it comes with a lack of understanding both of what depression or anxiety or any mental illness is about, and also understanding of what counseling or therapy or treatment is also about, and that can be a very positive process. And I always say, we all can use a little bit of counseling because it's a growing experience. It's one that taps into our inner resources. Okay, so that having been said, what would you say is a more desirable or beneficial approach? What should people be doing to support people who are diagnosed with depression, or what can people who are struggling with depression do? We touched a little bit on that as well.
Yeah, I think individuals who are suffering from depression, I think they need a lot of support and an acceptance. So individuals or family members who are supporting people who are suffering from anxiety and depression, put your judgment aside for a moment. Think of your worst day of being sad. Now think of that, being in a pit of that for days and days and days. It's a dark, deep hole. And sometimes it feels like there's no end. And I think it's important for family members to put aside their judgment and just try and be with that person in the place that they're at that moment in time. Because it makes it a lot easier if they don't have to pretend for you. And the other thing is then, sometimes they can't do the things that they would normally love to do. So to get up and cook, or to bath, or to just have a meal, sometimes it's really, really, really difficult for them. And just that support to say, I'm here with you. Let's go to the table together. Or can I bring you supper to the room? Or, just that little bit of a push, but not being harsh or hard, may be useful. Supporting them by just going there and being there when they go for their doctor's appointments. So you don't have to sit in, but maybe just being there or taking them for those appointments, because initially it can be difficult just getting there if you are suffering from severe depression. And sometimes your partner, if you're a partner or you're a mum or a brother, your family member needs for you to understand certain things, and they might want you to come in for one session, into the session, just to say, okay, you know what? This is what I'm going through, and this is what depression is, and helping you to get a better understanding of the condition. Sometimes it would be useful to get involved if they ask you to be part of that process. So I think that would be very important from my side, and making it possible for them to get to their appointments and to therapy and so forth as well. I
think what you're also saying is to participate in the process. and you use the word getting involved.
Yeah.
But what also came to mind for me was the word patience.
Yes, really
And it's
patient.
about understanding and saying, okay, fine, I know that this is what you're going through. What can the person who's experiencing depression do to encourage that kind of, is there anything that they can do to encourage that kind of participation or involvement from significant others?
I think the one thing is that we often think that the next person knows exactly what we want, especially when we're in relationships. So I'm talking about husbands and wives and so forth.
And that applies for general relationships as
Absolutely.
well, around expectations.
Absolutely. There's that assumption that my husband should know I want him to come to therapy, or my wife should know I want her to help me to get out of bed. Tell that individual what you need from them, even if it seems obvious, because what's obvious for me might not be obvious for you. So we all wired differently. We all have different understanding of things. If you want someone to just sit with you and say nothing, say, that's all I need from you. All I need from you is to sit next to me and say nothing. Or if you want them to hold you, all I need from you is a hug every morning. That's what's important for me, is that you've got to verbalize it. The person does not know, and sometimes it's scary for them because they're dealing with this big word depression or this big word anxiety, and they don't know how to tiptoe or what to do with you or how to do it. You've got to tell them, please just be normal with me. There's nothing wrong with me. I do suffer from depression, but I still am the person that I was.
Okay. I know that throughout the program, although we've mentioned the word anxiety, we focused a little bit more on depression.
Yes.
Is there anything around anxiety that's more specific around responses from significant others, around support? Is there anything different that sticks out that applies to anxiety and not to depression, or would you say that a lot of it applies in the same way?
I think it depends. Anxiety is quite broad in terms of what it is. So you get generalized anxiety where someone would worry constantly about just everything. And then we get anxiety which is linked to not wanting to be in enclosed spaces, not wanting to be in lifts, those kind of anxiety. Then you also get anxiety which is marked with panic attacks. And in those instances, you sometimes would need someone to physically do something for you. So to help you to get out of a certain space, to help you to just breathe. When you're in that space, if you're having a panic attack, the symptoms the treatment is very similar in terms of using antidepressants for anxiety and depression, but the sort of therapy would be different for anxiety as compared to depression in terms of what we target. So that would be that. But I think an understanding, I think from individuals, we would still need that understanding and that support.
I think for me, what it's also sounding like, and I could be wrong, but it would also require that the people around that person also have the ability to stay calm and to be able to help them feel like it's okay. It's okay.
Yes.
And
yes.
you just need to take a deep breath and we're here for you.
Absolutely.
Okay.
So I think, yes, anxiety would need the person would need someone to be more controlled because the individual is feeling out of control in that moment. But remember, I mean, we can have anxiety with depression as well, and it's a little bit more technical than that.
And that's why it's so important for people to learn and to educate themselves and learn to understand.
Yeah. Because you can imagine someone who's really, really depressed or feeling down can become really anxious. And someone who's really anxious can become really depressed after feeling panicky and overwhelmed all the time or most of the time. So I think, one can cause the other or the other can cause one. Yeah.
Jazakallah, Hanifa, for joining us today and sharing your expertise with us. And Jazakallah to all of you viewers out there for joining us on Get Real with Islamic Care Line. And we hope to chat again soon, inshallah, during our next segment. Jazakallah. Assalamu alaikum.